Hey friends, I wanted to give you a little update and my perspective on the coronavirus threat. Number one, it is a serious threat, and we have to be aggressive at the containment and mitigation efforts underway at the federal, state, and local level, and at the individual level, because there are common sense things that we can do, some basic hygiene that we can practice that will help prevent the spread and will help keep our fellow West Texans from being infected. When you compare where we are today in terms of the number of cases, about 1,740 deaths, with the tens of millions who've been infected with the SARS or MERS flu, and the tens of thousands who've actually died from the flu, we are in very manageable territory. We just have to continue to keep those numbers at a manageable level so that we don't see a spike in the volumes that could inundate the health system. And again, I feel good about where we are to date. The President and Congress have put resources behind expediting the development of a vaccine and treatments. We are trying to push out more testing kits and diagnostic tools, and then there are other protective gear that we need to make sure are readily available, so we're building capacity there. But the President declared a national emergency today, appropriately so. That's going to provide maximum flexibility for our providers, our hospitals throughout the country to spring into action and remove the barriers so that folks can move with great speed. I think speed and a sense of urgency is called for in this at this time. And I really feel like, as the President said and his team, in weeks to come, we're going to see this become even more manageable. So let's not panic. Let's keep our heads about us, and let's make sure that we don't get too whipped up in a frenzy when we know that we can get control of this and that all of us have to do our part. And but stay tuned. I'll give you updates. I did meet with local providers, local hospital CEOs, healthcare leaders, and our mayors from communities across the district. And I felt very good about their preparedness and their response plans. And they are coordinating with each other, with the states, and they have expressed to me the needs, concerns, and challenges with respect to the federal response. And most of that's around making sure we have capacity in the supply chain with respect to testing materials and other supplies, especially protective gear for our providers. So we're working hand in hand, and we've got your interest and your family's interest in mind, and we're gonna get through this. And I think in the next several weeks, we're gonna see this at a much more manageable level. Hopefully, anxiety will come down, and we'll get back to some semblance of normalcy. So remember, common sense, good hygiene, do your part, especially let's care for and be careful to protect the most vulnerable, our elderly and those with underlying health conditions that could present greater risk of catching it and of being really sick or potentially having a life-threatening situation. So God bless you guys. We'll stay in touch. Thanks for letting me represent you. Go West Texas.